plan for today is we finished environmental conditions, correct? Did we talk about this? Okay. In like one of the classes we covered half of it, we did standards, we ran out of time, so I had to cover the rest of it. I wasn't sure how far I went this class. So just to review last class, we talked about acute altitude sickness, or altitude sickness, high altitude cerebral edema, and high altitude pulmonary edema, and the differences between those two. And then we went into do cold-related emergencies, because there was a lot of things related with cold emergencies with altitude sickness. And then I think we covered heat-related, some of the skin conditions related with heat-related emergencies, lightning, and jet lag. I don't think we talked about jet lag, did we? Did we talk about everything else? You guys remember? I think Steph, you weren't here. You guys talked about lightning. I don't remember lightning. Okay, but we talked about everything else. Okay, so just a couple things. For those of you who weren't here, just review and then watch the class video. Lightning, just two things. There's not much you can do once it actually happens. When it happens, first things first, see and survey, make sure it's safe for you to go out there and manage the situation. Once you get to the patient, suspect a spinal, they're probably going to be in cardiac arrest, except if you were that guy on that video that got hit twice. He probably wasn't in cardiac arrest. He actually got up, walked a couple more steps, and then he got hit again. And then he got up again, so he's a superhero, actually. But when you get to the person, grab C-spine and then do your ABCs. And then just manage that situation as if it were any other situation. Okay, more likely than not, there might be some trauma-related injuries with the person versus medical. In preventing lightning strikes, we go by a 30-30 rule. Now, this is an NATA position statement. It's a lightning policy that they have. And the 30-30 rule is 30 seconds between when you see the lightning and when you hear the thunder. And then, so that's 30. The other 30 is 30 minutes after the last thunder or lightning. So the last piece of lightning you see or the last thunder that you hear, you have to wait 30 minutes before you can actually go back outside into the playing field. Okay, so that's where the 30-30 rule comes from. Okay. So 30 seconds between the flash and the bang. So how many of you have used this before, by the way? Okay. If you worked outside, it's very important to know. Working in Florida for 5 or 6 years, there was all sorts of lightning detectors. The 30-30 rule was one of them that we used. We used radar and we used lightning detectors on campus as well, only because, I don't know if you guys knew, but Florida is the lightning capital of the world. So as a result, we had to implement that on a regular basis. So that's lightning. As a therapist, there's not much you would do out there in the field other than just make sure it's safe for you guys. Once you get out there, grab C-spine and then just do your simple on-field assessment. Okay. With jet lag, this is more important with respect to prevention and making sure athletes perform at their best rather than actual on-field management. But it is something to consider. It's called Circadian Dysrhythmia. And are you guys familiar with the circadian rhythm? Like how your body goes through cycles throughout the day, hour by hour, and sometimes during the day, at some periods you feel really tired and weak, other times you feel really energized, and your body just goes through that rhythm on a regular basis. Now if that rhythm is disrupted, you develop symptoms. Okay? And they say typically if you cross 4 to 5 time zones, so from here to Vancouver or from here to Saskatchewan, it's not going to be that much of a difference. You won't feel the effects as much. If you travel 12 hours, like into Europe or into Asia, then you'll feel the difference. And so if you ever work with like Olympics and you're traveling across the world with major games, it is something to consider if you want to have your athletes perform at their best. Some of the symptoms that you'll note, fatigue, headache, GI discomfort, changes in hormone levels, heart rate, blood pressure changes, bowel habits, and so on. And there's a whole slew of them. The way I just think about it, if you don't feel normal once you land, and it'll probably last for a few days, then that's a sign of jet lag or circadian dysrhythmia. So here's some things that you can do to treat or prevent it. So to treat it, adequate rest and acclimatization prior to travel. Sorry, that's most of a prevention method. Hydrate, avoid alcohol, change the time on your watch and your phone right away. So the minute you get on the plane here in Calgary, change your time so you start getting used to the real time where you're going to be. And then adopt a new schedule and habits once you arrive. The last 2 points, when you travel east and travel west, this is kind of interesting. I've only seen this in Arnheim's book. I haven't seen it in any other books. So it's good advice. If you're traveling west, so if you're in Nova Scotia and you're traveling to BC, some things you could do to help acclimatize yourself and minimize the effects of jet lag. Eat light meals early and heavy meals late. Drink caffeine, exercise later, and get sunlight upon your arrival. Now, why? Why would you want to eat later? Why would you want to drink caffeine?
More energy, you could be like jet lag or tired or else.
Sorry?
I said it gives you more energy like in the evening when you normally like go to sleep or else. No way.
I think so. Actually, it's the opposite, right? If you're traveling from the east to the west, it's earlier. But where you came from is later.
So you want to be able to stay up later.
So you want to be able to stay up later, right? Because once you land, it's a little bit early, and you're like, oh, now I got to stay up until it gets late again. So that's why you would eat heavy meals. You would eat your supper a little bit later, and get in the habit of drinking caffeine, so that when you land in a place that's 4 hours early, you're not tired, you're still awake. And so you adopt the habits of that time zone. Yeah. Okay, now when you go the other way, it's the opposite, right? So if you're in BC and it's like noon, and you go to Nova Scotia, it'll be like 4 p.m. Okay? So when you're traveling east, eat your heavier meals earlier, don't drink any caffeine, and then exercise early. Because once you land, you're going to have to go to bed, because it's already late in Nova Scotia. Okay? So those are some of the things you can, that's some advice you can give to your athletes if they're traveling across the country or into another continent. So those were the last 2 for environmental. Do you guys have any questions about some of the material from we talked about last week or today? Okay. The first round of scenarios we'll do, so we'll do 2 scenarios. It'll involve anything on the environmental side that we talked about last week. Okay, so your goal, and I write this out on the agenda if you printed it up. So agenda 2, that's last week's class. The objective was to recognize and manage specific emergencies, specifically environmental. So in order to recognize, you have to be able to differentiate them. Some of the things that you might want to use in differentiating the conditions are the predisposing factors. So specifically where you are, what altitude you're at, what the environment is like. And then the differences in signs and symptoms. Now, if you approach someone and they say, I have a headache, do you know exactly what the problem is? No. There's so many different things that can produce a headache. So you might have to dig a little bit deeper with the signs and symptoms. Okay? So, what we'll do is we'll quickly review the process and what's expected. Again, I'll point out the small details that over the last few weeks people have been skipping. So point out those details, and then we'll do 2 scenarios, 1 scenario each between you and your partner on environmental. And then we'll cover the medical conditions. Okay? So, person is laying there, doesn't look like they're moving, you do your approach like we always talk about. When you finally get there, before you do anything, grab C-spine because you don't know what happened. Yesterday there was a few people that were tapping and shouting, slapping the mat beside the person and stuff. And just imagine this, if they're semi-conscious and you slap the mat or you pinch them and they potentially have a spinal, what could you have done? You could have startled them. Okay, so just make sure you lock C-spine first, then check your LOC and then ABCs. Okay, and again, just to reiterate, when you do your circulatory check in the primary, when you're just verifying, check the carotid, not the radial. Why?
You might not have radial.
Why?
There's a fracture.
Okay, it might not even be there. But it may not be due to cardiac arrest. It could be due to shock, a fracture, dislocation, for whatever reason. So you might be confused. If a person has a displaced humeral fracture and they lost a distal pulse, maybe in both arms, and you go and check their radial pulses, if you get mixed up, you might start doing CPR on someone that actually has a pulse. So Check carotid pulse when you're doing your primary survey. As soon as you're done this, lead and squeeze. Now, we're going to add a couple things over the weeks with respect to the process. You're going to be dealing with patients that are not supine anymore and patients that may be wearing football equipment. Okay, so we'll add the football equipment next week, but this week they'll be they'll be prone or sideline. Do you have to move them? You do not. If you have to move them, you have to make sure that there's nothing else wrong with the rest of their body before you move them. So do not roll or move them until after that, because this is where you clear it. If you find something, call your imaginary assistant to manually stabilize and then roll. You take C-spine because that's more important. Have another assistant take the leg that's broken. Have other assistants grab the body and roll if you need to. Okay? If you cannot thoroughly assess, then put them on their back, but do it safely. Okay? But do not move them until you've actually done that. Okay? Now, if you cannot do any of this because they're prone or sideline and whatnot, then you have to roll them on their back. So you don't even think about doing that. If you cannot assess thoroughly, put them on their back. Okay? Which means you don't have to bleed and squeeze. The other situation where you don't have to do this before you roll them, especially if this is missing, is if you're by yourself. Because you can't hold C-spine, you can't hold a broken leg, you're by yourself. Just roll them on their back and start ABC management. Okay? In most of our scenarios, you're going to have imaginary helpers. Okay, so we talked about the classroom in real life. In real life, if this is an issue and they're on their stomach, roll them. Do not worry about C-spine. Do not worry about broken bones or nothing. Just roll them and start CPR if you have to. That's more important. Okay. What's expected in the classroom is you do all this, bleed and squeeze, and then consider rolling if you need to. Once you've ruled out any life-threatening conditions, they're unconscious, so we automatically go into secondary. And with secondary, we do vitals first. And if you want to take your ABCs and get rate, rhythm, and qualities and stuff, we'll do heart rate, respiration rate, and blood pressure first. Those are our priorities. Skin can come later, core temperature, and eyes. So that's your priority when you take vitals. Take those first. Okay, and then take these second. For the scenarios, just mention, just pretend, so in the other class I just said, just take your pen light, pretend it's a tympanic thermometer, hold it by their earlobe and say, it's 37 degrees. And you've just taken core temperature. Okay? If it's different for the scenario, the model or the patient will tell you what the real temperature should be for the scenario. Okay, so let's say it's actually 35 degrees. Same thing like we did with the heart rate and blood pressure and stuff. Just report what you find. The patient will tell you otherwise. Okay. After your vitals, your head to toe. Okay, we talked about the focus secondary, history, observations, outpatient, special test, or sample. Okay, depending on your history, it'll either go into orthopedic or a medical emergency type of assessment. Okay? Now, the reason I put this side up is with some of the scenarios later on, if the person wakes up. Okay, so if at any point in time on this side, the person wakes up, so let's say in the middle of taking your vitals, they wake up, go right to your history. Just start asking questions. Okay? If for whatever reason, you started here because they are awake, and you're doing an assessment, and they go unconscious, go right back up to primary survey, check ABCs, and then start there. Okay? So, that's the process. For heart rate here, check radio, because that gives you an indication with respect to how, what the perfusion is like to the extremities. Okay? Because you've already assumed that they have a cardiac pulse, there's blood going to the brain. It's just how strong is the heart working now. So take a radio pulse. any questions? I put this up for about 3 weeks in a row. Okay, and I'm hoping that's kind of implanted in your heads now. If you have any questions about this, just make a note of them, and then we'll talk about it when we get back together. Okay. So these first scenarios are just going to deal with environmental emergencies. Okay? 2, 4, 6, 8. Perfect. Okay, so grab a partner, whoever the therapist is. So there'll be 4 groups. There's only 3 blue bags, but the 4th group, just grab one of the red bags because it has all the equipment as well. Whoever the therapist is first, just grab the blue bag, take it outside with you. I know you have to lug it out there. But just start putting the oxygen together. And if you guys want to talk about differentiating some of the environmental conditions, you can start talking about that as well. It'll take us about 2 or 3 minutes to set up in here. Okay? Okay. So decide who the therapist is, start grabbing the bags, and then go on outside. And then we'll set up this next scenario for you.